Okay, this is chapter 14, Homeostasis and Coagulation. So the homeostasis part is the body's ability to clot blood. Okay, this would be healthy forms of clotting, and the ability to stop the bleeding. Okay, so if you get hurt, you want your body to have the ability to stop the bleeding. Blood vessel injury, the body innately will try to heal the site by vasoconstriction, platelet plug, coagulation, and fibrin clot. Okay, now this is innate, which means we just are built with the ability and the ingredients to do this. Okay, now this should be familiar from A&P2, so a little review here. We have the extrinsic and the intrinsic clotting pathways. Extrinsic means injury to tissue that's outside of the actual blood vessel, and intrinsic means injury that occurs inside of the blood vessel. Okay, so we have tissue damage, and that is what is the common denominator between the two sides. There's some sort of tissue damage. Okay, then you're going to activate different factors, and the factor that we're going to focus on is factor 10. Keep in mind we have factors 1 through 13. Okay, and there's just some classic factors that of factor 1 through 13. There's some classic ones that are commonly mentioned and commonly studied. And if you're looking for bleeding disorders, that you would order first. Okay. So an important factor is factor 10, because once that is activated, okay, the extrinsic pathway, factor 7 activates factor 10, and on the intrinsic pathway, factor 9 is going to help activate factor 10. Okay, but our key is factor 10 is activated. Once that happens, then prothrombin is turned into thrombin. Okay, then factor 13 gets involved to help with the conversion of fibrinogen into fibrin, which finally makes your fibrin clot. Okay, this is our goal, is to get our fibrin clot. And there's a lot of ingredients and a lot of cascade of events in order to get there. Okay, so ingredients needed to clot blood. You need calcium, you need platelets, you need vitamin K, you need a liver, and you need your factors 1 through 13. Okay, now there's other ingredients as well. This is not an exhaustive list, but these are the ones we're going to focus on. Okay, signs and symptoms, patient history and homeostasis issues. So do they have a family history? For example, hemophilia. Do they have a decreased number in platelets? Are they over-consuming certain medications such as aspirin, NSAIDs, anticoagulants? Are they undergoing chemo? Because these are going to influence homeostasis. Okay, skin discoloration can occur with blood clotting issues, so you look for petechiae. purpura, ecchymosis, hematoma, and hemarthrosis. Okay, petechiae looks like this. Petechiae is these tiny little red or purple spots that you'll see on a person. Okay, this is an indicator that they may have a blood clotting issue or some sort of abnormality with hemostasis. Okay, minor trauma can cause this. So just bumping your hand against the coffee table or overstretching or something like that. Anything that can pop the capillaries, and the body has an abnormal ability to heal the area. Okay, purpura are basically bigger spots than the petechiae. Okay, these are bigger spots and sometimes they're raised. Okay, so you can actually palpate them. There'll be some sort of a texture to them. Is also an indication of there's something going on with a bleeding disorder and warrants further investigation. Ecchymosis. Okay, this is a discoloration of skin because of bleeding underneath the skin. These are classically known as a bruise. Okay, these are classically known as a bruise. Okay, this is usually the leaking of blood from blood vessels, and it's usually blunt force that causes this. Okay, so this exceeds the little micro traumas that can cause the petechiae and the purpura. A hematoma has this appearance where it's a pool of now mostly clotted blood that forms underneath the skin. Okay, so there can be a lot of or some overlap with ecchymosis and hematoma. Generally speaking, the difference is ecchymosis is fresh. Okay, so it's a fresh bruise, it just happened. And a hematoma is what forms later. Okay, the appearance or the color that forms later after the trauma. Okay, so they're both bruises. They're both pooling of blood under the skin, but it has to do with timing. Okay, and the hematoma, you can actually see the different stages of healing based on the color, right? So the clot forms and all the things, and then as time goes by, it should fade and it can change colors and spread and all that kind of stuff. Okay, now you're in your hematoma formation. All right, hemarthrosis. Okay, arthro is joint. So this is bleeding in the joint. So here's an example. There's bleeding inside of the knee there. If you jam your finger, your knuckle, it can swell. That is bleeding that happens within the knuckle. That's why it limits your range of motion. Okay, labs. Okay, labs are going to look for hemostasis issues. So you would run your CBC and you would look at platelet count. Okay, you want the platelets to be somewhere between 250 and 350,000, and then you can look for bleeding time. Other labs would be your PT, also known as prothrombin time. Okay, or the PT. And this assesses the extrinsic clotting pathways. Okay, there's different ingredients that are involved in the extrinsic clotting pathways, so your PT or prothrombin time lab would assess that. Okay, INR is International Normalized Ratio. It assesses the extrinsic pathway or extrinsic clotting pathway. So typically PT and INR are ordered together. Okay, aPTT is also known as activated partial thrombin time. Okay, correction, it's aPTT. Okay, I had a typo there, so make sure you correct that. Okay, so that's the aPTT is activated partial thromboplastin time. Okay, that assesses the intrinsic pathways. Okay, it also measures how long it takes your blood to form a clot. Okay, all these measure how long it takes for your blood to form a clot. Normally, when blood vessels are damaged, different proteins and other clotting factors will come together to clot the blood and help stop the bleeding. Okay, but that does take time. But you don't want it to take too long as far as time, so you can run labs on people to see where they're at. Okay, the TT, also known as TCT, is thrombin time. Or thrombin clotting time. Okay, it's a blood test that measures the time it takes for a clot to form in the plasma of a blood sample. The longer the thrombin time can mean an issue with fibrinogen or cancer proteins in the blood. An example of cancer would be multiple myeloma. Can also be a positive finding if the patient is on medication that affects blood clotting, such as heparin. Okay, a peripheral blood smear. So you take blood and you put it on one of those microscope glass slides. Okay, so there's going to be a blood smear on it. And then you look at the morphology. Okay, so if a person has anemia, jaundice, malaria, kidney failure, cancer, a blood smear can be performed. And then this is what it would look like under a microscope. Okay, so actually let's look at normal. So here's a normal red blood cell. Okay, and then you can tell over here that some of these red blood cells are simply not normal. Okay, so this one will show that as well. They can get into different shapes. Some of the classics would be like sickle cell, a stomatocyte, okay, a spur cell with all these spurs coming off of it, and so on. So this would be an example of what the morphology and what they look like under a microscope. Okay, here you're seeing the white blood cells. Okay, you can also look at the morphology of those. And the ones that are boxed and circled in green have abnormal nuclei. So their shape is off. Okay, so circled some damaged red blood cells there. Okay, so that's the advantage of looking at red blood cells under a microscope. Okay, thrombocytopenia is a decrease in platelets. Platelet lifespan is about 7 to 9 days. And things that can cause thrombocytopenia can be side effect of medications, the spleen can hold on to too many platelets, it can be from bone marrow issues or autoimmune. So you'd run labs looking for platelets, and you're looking for low numbers. So keep in mind, normal is 250,000 to 350,000. So the accepted low number of platelets is actually 50,000 or less. Okay, so that is, so on your lab printouts and all that stuff, for the most part, it's not going to red flag it until it gets down to 50,000 or less. Now, on the functional medicine side, that cutoff is 100,000. Okay, so think about that. So if a person's at 52,000 platelets, you're like, no, you're fine. It's like, no, you're not fine. Okay, something's going on. So if platelets are low, then you're going to have increased bleeding time. Okay, treatments for this would be medication, and you would rid of anything that can cause a decrease in platelets. So toxins, side effects of medications, if doable, get rid of them, or they're consuming something that you find is causing a decrease in platelet or hurting their platelet situation. Okay, a splenectomy, transfusions. Okay, those are some treatments. Okay, thrombocytosis. This is an increase in platelet count, 400,000 or more. A person risks stroke, myocardial infarction, okay, abnormal clots, okay, the harmful version of clots. Okay, treatment would be medications. An example would be aspirin. You can also do your natural things like omega-3, vitamin E. These things also can help prevent platelet aggregation. Okay, hemophilia is an inherited disorder of excessive bleeding. And the bleeding does not stop very well. Okay, so they cannot clot blood. Okay, there's type A and type B. So type A, this one is more severe. Okay, type A is more severe. It's about, of the hemophilia population, about 85% have type A. And it's a decrease in factor 8. It's considered X-linked, which means it comes from mom and she passes it to son. Okay, so it's a gene mutation. Okay, type B would be a decrease in factor 9. After that, there are other factors and other things that you can test. So since these are the more common ones, they would test these first. And then after that, they would start to split hairs if they need to. You can certainly dive deeper. Okay, labs. You're testing for the factors. You're going to run the PT, INR, and the aPTT. Your genetic testing. Okay, treatment would be medications to improve blood clots, clot promoters like stymate, with like desmopressin. Replace any of the missing factors. Plasma-derived factor concentration is another treatment. So your platelets are found in the plasma. Remember, when you spin down blood, you're going to get the red blood cells that go to the bottom, and then the platelets are going to be that top part, or let me say that better, the plasma is that top part, and then there's that buffy coat that's right in the middle. Okay, and that's your platelets. So typically speaking, when they separate the red blood cells from the plasma, the platelets go with the plasma. So if you give someone plasma, you are giving them platelets. Okay, von Willebrand disease is an inherited autosomal dominant disorder of factor 8. Okay, it hits males more than females, and it gets worse with age. Okay, factor 8 is one of those ingredients that is necessary for clotting blood. Von Willebrand is a glycoprotein. Okay, it's named after the person that founded it, so von Willebrand. It binds to other proteins to help clot blood. Okay, an example is that factor 8. Okay, signs and symptoms. A person usually bleeds too long, and they can usually tell that they're not clotting. That will be one of their complaints if they come in. Or has unexplained bruising. like all over the body. Okay, some unusual bruising that seems to surface or happen for no reason. Vitamin K deficiency is a decrease in vitamin K. Vitamin K is a fat-soluble vitamin and is necessary for blood clotting. Okay, just a reminder, your fat-soluble vitamins are vitamin A, D, E, and K. The significance of understanding your fat-soluble vitamins is a lot of people are deficient in their fat-soluble vitamins because of busted gut reasons. It's a very complicated process for your body to mineralize and emulsify so that you can properly absorb your fat-soluble vitamins. So as a result of just about everyone having a busted gut, fat-soluble vitamin deficiency is relatively common, especially vitamin D. Okay, vitamin K is absorbed by the intestines. Okay, and that goes back to busted gut. If the intestines aren't healthy, then you'll likely be deficient in your fat-soluble vitamins. Okay, then it's stored in the liver. Okay, then you have to think about people with liver disease, alcoholism, and all that. They're probably fat-soluble vitamin deficient as well. Okay, vitamin K functions a lot of factors such as factor 2, factor 7, factor 9, and factor 10. There are medications that can decrease vitamin K, such as Coumadin, NSAIDs, which is ibuprofen and all that, antibiotics, and anticoagulants. So you can run labs looking for vitamin K levels. You can run your PT, INR, and aPTT. Okay, vitamin K comes in different forms. We have K1 and K2. K1 is the phylloquinone. Now I broke that word apart so you can, so it's more legible. Okay, this is also known as K1. It's a short chain form of K1. It's less stable. It needs gut microbes to activate it. Okay, K2, which is the better form, is menaquinone. Okay, this is a long chain. It's more stable. It's absorbed better. And it is best taken orally, not through a shot, because it needs the gut microflora to activate it. Okay, so even for infants, they typically give the K1 shot, which is, it's like meh. Okay, first of all, it's a shot, so it's bypassing the gut, and K1 is just not as good as K2. So if you're going to take a vitamin K supplement, K2 is the best, even for the infants, okay, the newborns. You'd have to request it. That is not standard procedure to give K2. It's a more expensive form. Insurance usually doesn't cover it. Most people don't know about it. And chances are the only person in that hospital that will know about it is the pharmacist. So if you want to be an advocate for your baby and people are not working with you mostly because they don't understand, they're like, what's K2? Then just call the pharmacist. Be like, hey, do you have any K2? And they're going to go, yep, send it right up. And then make sure it's given orally. Okay, disseminated intravascular coagulation, also known as DIC. Okay, disseminated means abnormal clumps of thickened blood from inside the blood vessel. All right, it's if acquired, you're going to get clotting and thrombus. Okay, you can also since the clotting factors are used up, then you're going to get bleeding, okay, and hemorrhage at other sites of the body. Okay, signs and symptoms. Bleeding is usually first, and they can present with petechiae and ecchymosis. Can also get swelling in the lower legs. Okay, thrombi. If it's in the lungs, then the patient will have breathing issues as a sign or symptom. And if in the kidneys, then renal issues. Okay, they can also present with stroke symptoms. If neuro or brain. Okay, labs, you would run the D-dimer. D-dimer is a protein fragment. Okay, that is made when a blood clot dissolves. Okay, you can also run your PT-INR, fibrinogen, and platelets. Also your aPTT lab. Okay, treatment, transfusions with plasma. medications such as antifibrinolytics, antithrombin, and heparin.